It's a pleasure today to have Kevin Coughlin from Baystate Dental. I think this is going to be an interesting entrepreneurial story. So, Kevin, nice to have you.
It's a pleasure to be here. Thank you for having me.
And Happy New Year.
Same to you, Peter.
Thank you very much. So, tell us a little bit about Baystate Dental and about yourself. How long has it been around? What is it?
I started a general dental practice in 1983 in Springfield, Massachusetts. It became clear right at the onset that the public was demanding expanded hours, evening hours, Saturday hours, Sunday hours. At that time in the medical and dental profession, mostly the clientele catered to the doctors rather than the reverse. It became obvious to me that by expanding hours, weekends, evenings, holidays, the practice grew significantly, and that provided the impetus to expand and create smaller dental practices that have the feeling of a small business, the personal touch of a small business, but the infrastructure and the advantages of a larger business.
How many offices do you have now?
I currently have 11 practices, and I have 2 other practices under contract, which would bring it to a total of 13.
Have you grown by acquisition or by internal growth?
It's been a combination of both. The de novo practices, or starting up fresh, offer tremendous advantages. There's less time in negotiating with small business owners who many times don't understand what their accounts receivable are. They don't fully grasp what their payroll structure is. They usually do not have a good computer software system. And there's a combination of factors that sometimes dealing with small businesses are difficult to acquire. But there are occasions where acquiring a practice has the advantage of an existing staff, an existing reputation, and patient pool. So currently, 4 of the practices are acquisitions. 7 of the practices are de novo.
So you've really added one practice every other year, basically.
Yes. Generally, in a dental profession, you're looking at between 1,400 and 1,800 active patients. That means the individual comes in at least every 18 months. As a rule of thumb, if you can acquire at least 1,800 active patients, you usually have a client base successful enough to support one general dental practice.
Do you have partners in these practices, or is it just you?
Yes.